We're going to be getting started again. If everyone could get... Welcome back, everyone. We're going to be getting started with our morning of programming. We're going to start first with our Integrative Medicine session with Dr. Santhosshi Narayanan from MD Anderson Cancer Center, where she works in the Department of Palliative, Rehabilitative, and Integrative Medicine. Welcome, Dr. Narayanan.
Good morning, everyone. Thank you, Ms. Julie, for the kind introduction. And I would like to start my talk by thanking the Mesothelioma Foundation. So mesothelioma, as you all know, is rare cancer, and I've been interacting with many of you here. Some of you are meso warriors, caregivers, and clinicians, providers. So it is very nice to have everybody in one place, because we need to talk about it as a team together and see what your concerns are, what we can bring and what we can do. How can we address in the future? And I have these bracelets and I'm seeing all the efforts that the Mesothelioma Foundation is doing. The research, education, advocacy, support, all of this is important. So with that, I would like to talk about integrative therapies in cancer symptom management. I'm Dr. Narayanan. I go by Dr. N, just to make it easy for people. And I work at MD Anderson Cancer Center. So I practice integrative oncology. That's what I do, 100% of my clinical practice, and also do research about integrative therapies in cancer. So in terms of conflicts of interest, I don't have any conflicts of interest. I will see how I can advance the slides. I volunteer for Society of Integrative Oncology. I'm a board member there, and I'm actually flying right after this talk to go to the SIO conference at Boston. So I will miss interacting with many of you for the dinner this evening, but I would love to interact after this session before I leave. So in terms of what I'm going to talk about, I'm going to first discuss what is integrative oncology and what is the difference between alternative medicine versus complementary medicine versus integrative medicine. And I'm going to define integrative oncology. Then I'm going to talk about our integrative medicine center model at MD Anderson Cancer Center. And I would like to discuss the role of integrative therapies in symptom management based on guidelines. And the reason I'm going to address some of the guidelines, even though it's a lot of scientific information, is to give you the tools to discuss with your physicians when you go back home, that these are not something which is based on beliefs. These are scientific. It is evidence informed. So I'm going to discuss these guidelines just to convey that message to you all. And then I'm going to highlight the real world practice. So I give this talk globally, and one thing I see is that integrative medicine is still considered as a dream in many parts of the world. It's not happening. But in reality, it has to happen, and it is very easy to make it happen, and we all need to make it happen for every person dealing with cancer. So I will highlight the real world practice model that we can do. So first of all, I want to ask you all, If you are familiar with integrative oncology, you can raise your hands if you're familiar with integrative oncology. Okay, I see one person, two. Okay, so I will start with definition because it is not something that physicians or oncologists are also very familiar with. It's relatively new. It's almost 25 years the field exists, but not everyone knows about it. So integrative oncology is patient-centered, evidence-informed field of cancer care that utilizes mind and body practices, natural products, and lifestyle modification from different traditions alongside conventional cancer treatments. So if I'm going too fast, please let me know. Is this speed okay? All right. So in terms of the definition, one thing I want to highlight here is alongside. So integrative oncology is not something that is alternative to cancer treatment. It's alongside conventional cancer treatment. And what is the goal? Why do we want to learn about this? It is to optimize health, quality of life, and clinical outcomes across the cancer care continuum. This is during cancer treatment, during survivorship, during your clinical trial, and to prevent cancer. So for those caregivers who are here, this is also for cancer prevention, learning lifestyle changes that can prevent cancer during, before, and beyond cancer treatment. So in the next slide, I have the difference between the complementary versus alternative versus integrative medicine. Lot of people, when I talk to, a lot of my colleagues also confuse alternative medicine with integrative medicine. So alternative medicine, again, is used in the place of conventional medicine. So people do not do the conventional treatment and do alternative treatment. And we do also see patients coming back to us because alternative medicine may not work. So we always support patients to do integrative medicine, which is complementary therapies used in an evidence-informed manner along with conventional medical approaches. So complementary and alternative medicine use among people with cancer is very common. You can see 88%. But how many people discuss this with their oncologist is 61.8%. I think this is where conference like this and having a talk, I'm very impressed that Mesothelioma Foundation decided to include integrative medicine, because having a talk like this will help patients and the providers to come together and close this gap, because your oncologists need to know what all the complementary and alternative therapies that you are doing, because there is a risk of interaction, there are side effects, and at the same time, there should be no judgment. This is a place where we communicate openly and do the best for people who are dealing with mesothelioma or any other cancer. So is there anyone here who explores CAM treatments but have not disclosed with their oncologist? We will think of this as Vegas. What happens here will stay here. Yes? Yes? So there are people who do that, and thank you for being brave and raising your hands. So this is something that you don't have to feel that you shouldn't discuss with the oncologist. This is something that people should feel comfortable. And as I'm giving a talk here, I'm also talking to the scientific community to be open when people like you are sharing this. Because the gap of not knowing is a problem. Because if something is not working, the oncologist is blinded as to why it's not working, and the patient is blinded because you're doing two things, and it is a lot of stress to keep both the teams not know about each other. So let's take that stress away. Let's do this together. We are all one team. So integrative medicine as a standard of care. So this is a journal called Nature Reviews, and those of you who are providers, as you know, it's a very high impact factor journal. And Nature Reviews actually invited us to write this article in integrative medicine, which shows that there is a lot of interest towards integrative oncology, beginning to accept this as a standard of care for people dealing with cancer. So you can see there are several treatments here and several symptoms that is listed, and we did this table based on the guidelines. So first of all, there should be a lot of evidence for integrative therapies to appear in the guidelines. And the guidelines are, of course, that means it's evidence-based or evidence-informed. And we summarize the guidelines, and you can see in this table, for pain, you can use acupuncture, massage therapy, yoga, hypnosis, music. So same thing for arthralgia. There is acupuncture. Arthralgia is joint pain, acupuncture. Sleep dysfunction, acupuncture, nausea, acupuncture, cognitive dysfunction, hot flashes, night sweats. So there are several treatments here and several symptoms that can be used, several treatments which can be used to address the symptom. So this is our team at MD Anderson. So we have a team of 5 physicians, and we have two nurse practitioners, we have 3 psychologists, we have yoga therapist, we have music therapist, nutritionist, physical therapist, acupuncture therapist, mind-body therapist, massage therapist, research team, finance team, administrative team, and several other team members. And we all come together to address the needs of people with cancer. So what is our model? So our model, when a person sees us, is to focus on physical health aspects, mind-body aspects, and social aspects. And this is something that you can remember when you're dealing with mesothelioma, on how you can address all these components on you or the person that you're caring for. So in terms of physical health, I will go over all these in detail, but we will be talking about exercise, nutrition, acupuncture, massage therapy, coordinating with other teams like supportive care, pain management teams, physical medicine and rehabilitation, primary oncology team. And then we have the mind-body aspect, psychology, meditation, music, Tai Chi, Qigong, yoga, and then the support group, like social work and other support programs. We have group classes and other groups where people can come together and talk about their health. So the minute that a person walks into our clinic, either in person or virtually, we do this questionnaire. So we ask people to rate the symptoms on a scale of 0 to 10. So this is something that you can do to keep a track of your symptoms too. So this is called ESAS, Edmonton Symptom Assessment Score. It just keeps a track of your symptoms like pain, fatigue, nausea, and it is as simple as scoring the symptom from 0 to 10. So this serves as an X-ray for me to understand what my patient is going through, so we can address that, because often when people are seen, all the focus goes on the cancer, which is very important. But it is the person who's dealing with the cancer, and the family is dealing with the cancer. And so many other factors come into play, and that needs to be addressed too, to make it a whole person approach or a holistic approach. So then after completing this, people will see one of us, 5 physicians, and we talk about diet, exercise, mind-body, sleep, and symptoms. So this is something you can take a picture, take a printout, and put it on your fridge. Of course, you don't need to put our pictures, but the 5 circles of diet, exercise, mind, body, sleep, and symptom. And then when we talk about this, we refer people to various services, but we will also give recommendations in different areas for a whole person approach. So when we look at what does the patient want from us, and we address this in terms of like 2019 versus 2020, and we compared it, but it doesn't matter which year it is, people want symptom management because there is a lot of concerning symptoms. And then we compared what are people wanting and what are the oncologists wanting, and both are exactly the same. So the patient concerns are nutrition, pain, and integrative approach. And that's the same reasons for the referral by oncology team. So even though oncology team may not have the time to discuss diet, about a lot of symptoms, integrative approach, that's what they want too, but they just want to focus on the cancer in their limited time. And these are integrative interventions without focusing too much on the numbers. I would say that when we looked at our clinic model and what therapies we are offering, it was based on research and evidence. Acupuncture was offered for fatigue, nausea, neuropathy, hot flashes, pain, dry mouth, massage therapy, and I will discuss a little bit more about these because this slide looks like too many numbers. I want to discuss this when there's a picture to cause less stress for your eyes. So NCCN guidelines, the reason I have this slide is because in the US, NCCN clinical practice guidelines is a gold standard in oncology. And when you look at these guidelines, integrative therapies are included. So if you're talking to any oncology providers and if you are told that it's not evidence-based, you can always say that NCCN guidelines include integrative therapies. Of course, that does not mean that something which is not safe is included here, but certain treatments which we will go over are included in NCCN guidelines. Like cancer pain has integrative therapies, fatigue has integrative therapies, survivorship has integrative therapies. Vomiting, nausea has integrative therapies. So also we have guidelines from Society of Integrative Oncology. This is where I'm going for the conference today. The conference is starting tomorrow. So SIO also has a global presence, and SIO collaborates with ASCO, American Society of Clinical Oncology, and we have SIO ASCO guideline too. So the guidelines that are so far developed are pain, we have anxiety and depression guidelines, survivorship guidelines. We are working on sleep guidelines next, but I will just show a sample of what guidelines look like. So SIO and ASCO guideline for pain suggest acupuncture, reflexology, massage, and hypnosis for various types of cancer pain. And you can see there is a mention of breast cancer here because I will say that because it's one of the commonest cancer. We do a lot of research for integrative therapies in breast cancer. Mesothelioma being rare, there is not much integrative research in mesothelioma, but it should happen because there may be something that is unique to people with mesothelioma that we may be able to find, but it's not happening right now. But many of these principles will apply to mesothelioma. So we can apply many of these integrative therapies for people dealing with mesothelioma as well, like acupuncture, massage, hypnosis. So again, 5 circles. I think this will be a better one for your fridge because it doesn't have our pictures. So diet, exercise, mood, stress, sleep, symptoms. Again, this is how we approach our people. And first, I would like to talk about diet. But I know there is a full talk on nutrition and cancer after this session. So I will try to keep it brief and focus on what is important from an integrative standpoint. So the first thing I always tell my patients is avoid sugar because the sugar spikes is not good for cancer. And it doesn't mean you should not touch sugar at all because I think there is science, but you also have life. So I tell my people, like, enjoy, but in a very limited quantity. And that is how I started eating because I want to know how my patient feels like, so I will not eat more than a little bit of sugar. I exactly eat sugar in a way that I want my people to eat. So maybe if you're going for a get-together or a celebration, a very small piece of cake, maybe like 2 spoons. If you're eating ice cream, eat in your spoon, not in a cup. Right? So enjoy, but use very less quantities of sugar because sugar is not ideal in cancer metabolic pathways and you want to stay away from sugar. Refined carbohydrates, again, will spike your blood sugar, so do more whole grains. Whole grains help with fiber content, and fiber is very helpful in terms of your gut microbiome. Have you all heard about gut microbiome? Yes? Yeah, I see many of you heard about gut microbiome. So gut microbiome plays a role in immune system. So if you want to keep your immunity strong, you want to keep those small bugs in your gut happy. And for that, they need fiber. Fiber helps them. So whole grains, beans, lentils, all that high fiber diet will help with your gut microbiome. Of course, if you had a surgery and if you cannot tolerate fiber, that needs to be tailored accordingly. But the other question that I get frequently asked by people is, can I just do probiotics? Well, probiotics, you will only get the bacteria that you can manufacture in the lab, whereas you can manufacture more. because we are humans, we are better than lab, right? So we can manufacture much more. So, and this was shown in one of the research study, which was done in MD Anderson, which showed that people who do probiotics versus people who do not, the spectrum narrows down when you do probiotics. So it is okay if you're coming out of antibiotics, if you have to do it for a short term, it's okay. But for long term, I wouldn't be taking it every day. I would do natural things like good fiber diet to help the gut microbiome, which in turn improves the immune system. And this is more important for people on immunotherapy. So if you're on immunotherapy, good fiber is important. So secondly, I would advocate for more plant-based proteins. So I don't ask my patients to become a vegan, because especially when you're on chemotherapy, it may be challenging to meet the protein requirement that is needed when you're going through chemo. So it's okay to do animal proteins, lean, clean animal proteins, but at the same time, do majority of your proteins coming from the plants, like beans, lentils, nuts, chia seeds, hemp seeds. There are so many good plant-based proteins that you can do in addition to the animal protein. Healthy fats like omega-3 is important. Omega-3 fats decrease inflammation, like avocado, olive oil, nuts, and all these. So improve your omega-3 intake. And lots of vegetables, of course, fruits. And I saw somebody eating an apple there. I think you, ma'am, I saw you eating an apple. And great to see apple there in a snack. So incorporate fruits, incorporate vegetables. So yeah, and maintaining the weight as well. So I'm not promoting weight loss here. Weight loss is important in many cancers, but if you're dealing with mesothelioma, we don't have to eat. Some people have told me that they're eating more fatty foods and ice cream to gain weight. And that doesn't have to happen, because excess fat is not going to be very helpful. You want more muscle. So it's okay. I would not promote undereating. Eat a nutritious food, but you don't have to work on gaining a lot of weight by eating things which are not healthy for you. So exercise. How hard it is to exercise, even for people with no cancer. It is very difficult to maintain a daily exercise routine, right? So, and when people are dealing with cancer, we are asking them to exercise, and this can be challenging. But it is important, because when you exercise, not only that you keep your muscle during chemotherapy, you don't lose that muscle, and you also will reduce your inflammation. Research is showing that interleukins, which are inflammatory cytokines, drop when you exercise. And the evidence is stronger for strength training. So you don't have to lift like 100 or 200 pounds, but even small amounts of exercise, strength training can be very helpful. Of course, please always discuss with your healthcare provider. There is several things. If it is neuropathic symptoms, be cautious. We don't want anybody to be falling. We don't want anybody to be exercising right after surgery. So with supervision of an exercise professional or a physical therapist or occupational therapist, please consider exercise. So has anybody felt like this? Need an easier job, smaller house, different family, and no mesothelioma? Yes? Yeah? It is completely fine. If you felt like this, it's completely fine. I think everyone feels like this at some point. And, added to that, if there's treatment and you have to have all these doctor's appointments, yes, of course, it does feel like this. But this is the thing. Often, we focus on a lot of things when we are dealing with cancer, but we don't take care of the mental health. And mental health is very important. And this is just a fancy diagram to prove what I'm sharing with you, saying that mental health is important. So in this picture, you can see the brain, and you can see the stress hormones released by adrenal gland, and the stress hormones having a direct impact on the tumor cell, right? So there is a direct impact of stress on tumor through the stress hormone, norepinephrine, epinephrine, adrenaline, and other hormones. And again, this is a closer look of the tumor cells. You can see something here which says DNA repair inhibition, oncogene activation. Stress stimulates oncogenes and inhibits DNA repair genes. So managing stress is like taking medications, taking a pill. So management of stress should be a part of everyone's treatment plan. And it is not very commonly done. But this itself is a treatment. So include that in a part of your treatment journey. And again, more evidence showing that depressive symptoms and cortisol, the stress hormone, having a role in inflammatory signaling and survival. So many other research which proves that. So as far as the guidelines, there is also anxiety and depression guidelines here. And without going too much into every single aspect of it, I would say the mind-body practices. Most of the treatments listed here comes under mind-body practices. You can see meditation, you can see yoga, relaxation therapies, music therapy, reflexology, hypnosis, lavender essential oil inhalation. Of course, if somebody has, this is not applicable for mesothelioma, but if somebody has breast cancer, it's better to avoid lavender essential oil because it has an estrogenic ring. But for mesothelioma, it's fine to use lavender oil. Yoga, acupuncture, Tai Chi, and again, depression. A lot of mind-body therapies, yoga, music therapy, relaxation, reflexology. So this website, anybody can access this website. We have some videos there. We have meditation, we have yoga, we have music and Qigong. This is our website. And we have group clinical services as well. These are group classes that anybody, I think it's not just restricted to MD Anderson patients. Anybody can participate in these group classes. We have yoga, Tai Chi, meditation. So this is something that you can consider. Again, more research. Tibetan meditation during radiation, yoga, and so many other things. Expressive writing. So expressive writing has also been studied in renal cell, which can be done in mesothelioma as well. So if you write your emotions, journal, all that can help. So getting to mind-body therapies. So music therapy is another one which is helpful in many symptoms, like, for example, nausea. It does have a role for anti-emesis or nausea management. Music therapy also has a role in stress management. Music therapy during surgery, before surgery or after surgery, in a peri-op setting, the research shows a lot of support for music therapy in this setting. Yoga therapy, even one session of doing yoga, which is, of course, safely tailored to people, not right after surgery or 1 month after surgery, probably 6 to 8 weeks after surgery, shows that even one session can help multiple symptoms like anxiety, stress, and many other symptoms. So acupuncture. How many of you have tried acupuncture? Oh, a lot of people. That's great. Acupuncture helps with many symptoms. So I'm glad that you have tried. And for those who have not tried, please don't get scared by needles. You can see the needle there. It is a very thin needle. It's nothing like a blood draw. So it's not going to be that painful. Some people might feel that there's a little pain, and some spots may be painful, but overall people tolerate it very well. And again, it's evidence-based. So some people do tell me, especially people out of town, out of Houston, tell me that they were told by their oncologist not to do it during chemotherapy, but that is not true. Guidelines are supportive of doing acupuncture during chemotherapy. Just don't do it if your platelet counts are very low, like below 25, or if your neutrophil counts are very low, like you have to wear a mask, and you cannot go out, you can only eat, you cannot eat raw vegetables. So when you're so prone to infection, when you're neutropenic or thrombocytopenic, that even chemo is not given without boosting your white cell count, then that point don't do it. But otherwise, if you're doing well on chemotherapy, it will help your symptoms, it will help your pain, it helps with fatigue, it helps with nausea. So it's not a contraindication during chemotherapy, and it can help with neuropathy as well. So neuropathy is numbness and tingling in hands and feet that happens with chemotherapy, which damages the nerves. So acupuncture helps those symptoms, and it helps reduce inflammation in the nerves. And for some people, it can fully reverse neuropathy. So please consider acupuncture. You can educate your providers. Of course, they will be open to looking up the guidelines that acupuncture is a part of guidelines in neuropathy. Massage therapy. How many of you here received massage therapy? A lot more people. Very good. So again, this is another concern I hear about cancer massage or regular massage therapy when you're undergoing cancer treatments. I would say to keep the same guidelines in mind. If platelets are below 25, don't do it. If you're neutropenic, don't do it. We don't want people touching you when you're neutropenic. But all the other times, massage therapy will be very good when you're combining it with cancer treatment. So consider oncology massage, especially for pain, fatigue, constipation, neuropathy. So many indications for massage therapy. So sleep. How many of you here can sleep 100% fine without any issues? One person. Two here. Only two people? Okay, so a lot of sleep disturbances. This is just our clinic data showing that almost like more than 3/4 of our people are not sleeping good. And why is sleep important? Sleep is so important because when you are sleeping, your body is going through repair. It's reducing inflammation. It's improving your immune system. Even one night of lack of sleep can impact your immune system. And when you're dealing with anything like infection, inflammation, and cancer, the sleep becomes critical because you want to keep your immune system in the most functioning way to deal with either the bacteria or the cancer cells or whatever that you're dealing with, which is invading your body. You want to fight it with the best that you got. So immune system is important, and therefore, sleeping well is important. So in your Fritz sticker, sleep is one of the circles. So how do you improve sleep? Well, there are several things that you can do. So one is sleep hygiene, not watching TV, cell phones, and I think most of us are guilty of that, correct? Yeah, so sleep hygiene is very important, and sleep ritual is important. This is one of the things that we counsel every single person. Even though it's common sense, most of us don't do it. And then, once you are very good, you are 100 out of 100 on all the things that you can do. You're doing sleep hygiene, not watching TV, you're sleeping at the same time, waking up at the same time. If you're still not able to sleep, acupuncture can help. This is a trial of electroacupuncture on insomnia, and it showed good results. And we use acupuncture to help sleep in our clinical practice. Of course, it is not the only treatment. It is combined with everything else. Of course, counseling on sleep hygiene, sleep ritual, cognitive behavioral therapy, which is performed by trained psychologists, can be very helpful. So journaling can be very helpful. So see a psychologist also if you're still not able to sleep despite journaling and all the other techniques that you're trying. And consider electroacupuncture for sleep as well. And yoga can also help, and meditation can also help. But don't try to meditate to go to sleep because we know that doesn't work. But being relaxed, being mindful can help improve the sleep patterns. So has anybody felt like this? Like you're so tired that my tired is tired? Yes? A lot of people. Anybody did not feel like this? Okay, nobody. So fatigue is one of the most distressing symptoms. So one thing which I don't like about cancer fatigue is that it is not relieved by rest. So people tell me all the time, and the definition is it's not relieved by rest, that rest does not help with cancer-related fatigue. Fatigue can be from different reasons. So if the rest is helping you, then there is some other component that's going on in your health that needs to be given attention, that needs to be fixed. Probably sleep, probably nutrition, probably exercise. So there are several things that needs to be attended to. But if you're doing everything and you're resting and you're still not able to feel the relief, then it is cancer-related fatigue. It is caused by several reasons, and one common pathway is inflammation. And it can be experienced even after, in survivorship too. Even after finishing cancer treatments, people don't feel the same energy, and that is because the body still is fighting inflammation, body still is recovering, and that causes cancer-related fatigue. So again, there's too much content here, but just focus on the blue box. And this is again guidelines, NCCN practice guidelines, which is the gold standard. And you can see here physical activity. So in early part of my talk, I mentioned how exercise is important, especially strength training, to make sure that you have your muscles which are preserved and decreasing the inflammation and not losing the muscles, because muscle loss is a big issue during chemotherapy. We want to prevent that. And physical activity, especially strength training, helps the fatigue, helps preserve muscle mass. Yoga can help. Massage therapy, CBT, nutrition, sleep hygiene, light therapy, so many things. But category 1, which is a higher category of recommendation, recommends physical activity, massage, yoga, and psychoeducational. So again, this is nausea guidelines, anti-emesis guidelines, NCCN. It includes the therapies that we just talked about: hypnosis, relaxation, guided imagery, progressive muscle relaxation, music therapy, yoga, acupuncture, and anxiolytic therapy. Because one component is physical. Nausea happens because of the chemo. There is also an emotional component to it. So you want to address both the physical component and emotional component. Nausea is very disturbing, and just the feeling of having nausea creates more nausea. So addressing the whole thing, acupuncture, the feeling with behavioral techniques, relaxation, all these can help with nausea. And guided imagery and progressive relaxation, if you go to the website that I had before, we do have some videos of guided imagery that anybody can access. Basically, you're imagining something, and there's so many samples on the internet that you can try as well. And progressive muscle relaxation is that you relax each and every part of the body. Like those people who meditate knows that there are some meditation techniques where you relax your leg, then you move on, like you relax your hands, forearms, arms. So that's progressive muscle relaxation. That can also help with sleep. So herbs and supplements. So how many of you here take the supplements, herbs and supplements? So many. So many. Okay, so now we know one person is not telling the oncologist, the other people, we don't know if they're sharing or not, but I found out who's taking it. Okay, so it's good that you are taking it and you're open about it, but what needs to happen is there needs to be a discussion to make sure that these supplements are not interacting with the conventional cancer treatment. So that is one aspect of your care which is important. Because on one hand, you're trying to do something, your oncologist is trying to do something, and both may not agree with each other. And the chemotherapy, the herbs and supplements, both are metabolized by the same enzymes. So our body doesn't differentiate that, oh, this is chemo, I'm going to send to this part of my liver. Supplements go to the left side of my liver. No, it's the same enzymes. So when the same enzyme, I wish there was a system like that, so I don't have to worry, and I can let my people take what they want, right? But it doesn't work in human body. The human body is not engineered by us, right? So we need to respect it, of course. So we need to check what is the cytochrome enzyme, which metabolizes the supplement, and what is the cytochrome enzyme, which metabolizes the chemotherapy. And make sure that it's not the same. If it is the same, it can be an enzyme inducer or an enzyme inhibitor. An enzyme inducer, if your supplement is an enzyme inducer, it will make the chemo run very fast through your body. So that will make it not very effective for the cancer. If it's an enzyme inhibitor, it's going to keep the chemotherapy longer in your blood. So that is going to increase the adverse effect. So you don't want this, and therefore you need a discussion to see what is the enzyme which metabolizes the supplement and what is the enzyme which metabolizes your chemo. And whenever you're taking a supplement, the more you talk about it with your medical team, it helps. For example, hepatotoxicity. Sometimes the liver functions go up, and it could be from the chemo, but it could also be from green tea extract. A lot of people take green tea extract. So if you ask the AI, some of my patients tell me very honestly that they use the AI to create a supplement list for them, and they're so happy because now they have the whole list of supplement. Of course, I don't want to kill the excitement. I'm sure it's very important for them. But the concern is green tea extract, for example, is hepatotoxic. So I encourage the use of green tea, but when you use the green tea as a pill, as an extract, it can be toxic to the liver. So in those cases, if you want to get the benefits of green tea, drink the green tea, because the ECGC is very good. It's anti-inflammatory, but do not take the green tea extract. So the same way, for example, medicinal mushrooms. A lot of people take mushrooms, medicinal mushroom supplement. This is one of my favorite area, and it was not my favorite to begin with. I had no clue what I'm dealing with when I saw medicinal mushrooms. But a lot of people like you educated me. They bring these studies and show, oh, this is based on, okay, let me look at it. Then I started reading and I got so interested in it. So I looked at almost 10 years of research of medicinal mushrooms in cancer and published a systematic review. And what I found was impressive. Lot of studies that I looked at, almost 2,000 papers, 2,000 to 2,500 papers I read, and out of which 39 I selected for the final review, because in systematic review you have to go through everything and see what merits the final review. And in the final review, we found that 31 out of these 39 studies showed beneficial effect for immunological response, positive immunological response, positive quality of life. Am I telling you all to be in mushrooms? No, that's not what I'm trying to say. What I'm trying to say is that there are compounds like this which benefits immunity. But at the same time, many of these studies were done in Japan. Few studies done in US. One study, which was done in MSK, showed opposite effect. For example, at one dose, maitake mushroom stimulated immunity. At another dose, it decreased the immunity. So we need to do more studies. So there's a lot of studies in Japan, and GI cancer has a lot of studies, so I feel a little more confident with GI cancer. And mesothelioma, there is not much for medicinal mushrooms. But I think it has the future, especially combined with immunotherapy or just to stimulate the immune system. But we need to just study the role of medicinal mushrooms in mesothelioma and make sure that it's not decreasing the immune system. So that needs to be done. But until that is studied, what I would suggest for you all is to eat the mushrooms. If mushrooms have immunological response, please eat them. When you find it in the grocery store, buy it, eat it. Of course, do not eat magic mushrooms. That's not what I mean. Eat other mushrooms. Yeah, don't blame me, Silas. I'm not asking to eat magic mushrooms. You can cook and eat the mushrooms. So cooking and eating mushrooms is always good. I'm not against magic mushrooms. I think it does have a role as well in many aspects of cancer. It is being researched in our center, and it has to be done under very close medical supervision. But of course, don't try to experiment with it. So the other aspect is antioxidants during treatment. So the next question people will ask me is, well, I am not on chemo, I'm getting radiation. Can I do these supplements? Well, even during radiation, you are trying to kill the cancer cells with oxidants. So often people are told to avoid antioxidants, but there is a lot of misunderstanding with that, because some people tell me that they stopped eating the berries because it's antioxidant. They stopped eating turmeric in their food because it's antioxidant. Well, there is no worry if it's about the food. It's okay to eat antioxidants as food during radiation, but do not do antioxidant supplements, because you can see the research here. There was a study which was done in head and neck cancer patients, and it showed that when people were randomized to supplements versus placebo, people with supplement arm had less adverse effects, like local adverse effects. That means that the antioxidants were protecting the normal cells. But people with supplement arm also had increased rate of recurrence. So it was also protecting the cancer cells. So this is one thing that we also worry about cancer treatment using supplements. When you use supplements, the antioxidants will try to protect cancer cells and it will protect the normal cells, and we don't want any protection for cancer cells. So until we further clarify this in more research, it is best to avoid antioxidant supplements when you're dealing with cancer treatment. It's okay to still eat antioxidant foods when you're on cancer treatment. So how do we make this decision? How do we make a supplement decision? And you can use this for your own health as well, and use this to talk to your doctor. It's always like common sense, anything else in life, you go through risk benefit. Is there a risk? Is there a benefit? What is higher? If the benefit is very small and the risk are high, of course, if the conventional treatment has good prognosis and it's working well for you, and if this supplement can be risky, it's better to avoid it. Or if the treatment is not working so well and the supplement is very promising, then consider discussion, consider interaction check, so that you are supported by your medical team, and your medical team can monitor your liver function test and renal function test, because monitoring is also important. Even things like vitamin D, I highly support people taking vitamin D to maintain good levels, because vitamin D is important in cancer immunity. But blindly taking it without checking the levels, I would not recommend, because too much of vitamin D can cause kidney stones because of the way it works with calcium absorption. So check your vitamin D, just a simple blood test, and take your vitamin D supplement. But make sure that you all get your vitamin D level checked when you're dealing with any type of cancer or even cancer prevention. I think everyone should get their vitamin D level checked and be replaced on the right doses, so that our immune system, especially the cancer immune system, is good. So again, this table just talks about the risk versus benefit, which is something that we commonly use in our clinical practice to counsel on supplement. So these are some of the resources. You can take a picture of the slide. Consumerlabs.com, TRC Naturals, and many others, herbs.org that MSK has. So many of these resources will give you information about supplements. It will make sure that it gives you information about, like, if it's clean or not clean. You don't want contaminants. You don't want heavy metals. We just recently saw how protein powders are contaminated with heavy metals. So we need to be very cautious, because you don't want to overwork your body. Your body is already fighting something that is not normal for it. So let's not overwork our body, and more natural is always better. And supplements may be natural, but it's not 100% safe. All natural does not mean 100% safe. So check it out. Even though the website may look fancy, check out in one of the standard websites. Make sure what you're putting in your body is clean, pure, tested for heavy metals, and free from contaminants. And of course, the interaction as well. And get your liver, kidneys, and all the other parameters monitored. Okay, so key takeaway from today's talk is that integrative medicine involves approaching people as a whole, physical and emotional health aspects. So integrative medicine, what I don't want to see it becoming, is just a supplement medicine, right? So often there is a misunderstanding. You go to a regular physician, you get medicine. You go to an integrative physician, you get supplements. That's not how it works. Integrative medicine focuses on you as a whole, the whole person. Physical aspects, mental health aspects, and things like that. There is not one supplement that will reverse the effect of stress on the body, right? So we need to work on multiple things. It may not be easy. I would prefer to just have easy practice, like just give 1, 2, 3, 4, 5 supplement, right? But it doesn't work that way. We need to make sure people eat right, people exercise, people are dealing with stress, they're sleeping good. All these aspects are important. So the role of mind-body approaches, yoga, meditation, music for stress management. It's everyone can pick what they want. It's not one size fit all. If you don't like yoga, go for Tai Chi. If you don't like Tai Chi, go for meditation. So there's so many things. Qigong, there's so many things. So pick the one that is going to help your mind and body. And spirituality is very important too. Religious coping is very important too. Like one of the studies we looked at, we saw that religious coping and going to church actually helps the symptoms, and positive religious coping helps people's symptoms much better than negative religious coping. So being involved in religious systems, spirituality, all that helps too, and it's very good for mind and body. Acupuncture, massage therapy can be integrated in symptom management. Of course, just be mindful of the contraindications. As I said, chemotherapy is not a contraindication, but neutropenia and thrombocytopenia, which is low platelets and low WBC is, so monitor that. And herbs and supplement have an open communication. Please don't hesitate to bring this up to the physician, please ask that they check with interaction. If you have an integrative medicine team, that is wonderful because they're trained to do that. This is what they know, how to check the interaction and things, but anybody can check that for you. You can also try to check, but it's easier if a medical person checks it. The websites that I showed you in the previous slides, TRC Natural, it gives a list of what all the cytochrome enzymes which metabolizes the supplements, so that can actually help you to check interaction. But open communication is the key. So with that, I thank you all for your attention. So this is my son drawing mushroom on top of the heart for Mother's Day. But I'm on LinkedIn. If you have any questions, write to me. I'm going to be around for a few more minutes, so if there's any questions, please talk to me. But thank you very much for having me. Thank you, Ms. White. Thank you, Mesothelioma Foundation, and thank you, everyone here.
I was going to have a few people ask.
Yeah, if a person is considering acupuncture, do they need to go to someone that's specifically trained in cancer acupuncture, or is a generally accredited acupuncturist good enough?
Great question. Thank you for asking that question. So there is a website, and I will spell it down. You can write it. NCC, Nancy Charlie Charlie, AOM.org. America, Ohio, Missouri, AOM.org, NCCAOM.org. So this is a website which lists all the certified or certified or licensed acupuncture therapists. So if you go to this website and put your zip code, you can find the acupuncture therapist in your area. So in terms of oncology, most of the acupuncture therapists do have some training, but of course, if they're not doing it every single day, their experience may be different, but most of them should be able to do what they can do. And when people see me in MD Anderson, I try to tell them to see at least 1 to 2 treatments with us. So if you're closer to any big integrative center, which only takes care of people with cancer, and if you got an acupuncture there, you will have access to the nodes. Of course, they cannot tell local people what to do because that's not standard practice. But if you have access, you can take it to your local providers. And most of the people, for common symptoms, nausea, neuropathy, fatigue, the treatment should be almost consistent. But one of the things that we do see in research papers is lots of variability between individual practice. It is like people having a viral upper respiratory infection, different, and some bacteria. Different physicians will choose different antibiotics based on judgment. So it works like that. But I would always ask that you try. And do not give up based on one treatment. Acupuncture does not work with one treatment. You have to have at least like a couple of weeks before you can see the effect. So if one treatment did not work for you, do not give up. Try for 2 or 3 treatments before you can say, because it's stimulating your body to do something, and each of us respond differently to acupuncture. So it's hard to compare how you responded versus your family member responded versus your another friend or another person in support group responded. So, so do consistently for 2 to 3 weeks. Go to a licensed provider, and if your platelet count is very low or if your neutrophil count is very low, pause during those times. Thank you for that question.
What do you think about the infrared sauna as a light therapy?
Well, thank you. So things like infrared sauna, light therapy will be good to do, but we don't have a lot of data for me to ask people to do this. But again, if I look at the risk versus benefit, the risk is very low, and the benefits are not very clear. I would say go for it. So if the benefits are not 100% proven, but the risk is very low, there is no harm in doing it, because you want to explore things that you feel strongly about if the risk is very low. So I would say go for it. Thank you.
So a little bit of a follow-up on that. Were you talking about red light therapy, not just the infrared, but I bought these full-body red light panels, and right at the end when I was setting them up, it said, warning, it could also repair cancer cells, like they're not sure. That's what the manufacturer put in there. I didn't know if that was a typo, but when I went on your guys' website, you actually do some kind of red light therapy with treating some
We currently at MD Anderson Integrative Medicine, we don't do infrared therapy or red light therapy at this point, but that is something that we might explore in the future. But currently, there is not a lot of data to support it. And when I go to European conferences, there is a lot more talk about red light therapy. I think we need to do more here and see how our people respond with red light therapy and how the cancer responds. And if I think of mesothelioma, it is very hard to see how exactly it's going to help. So I think we need to study more and bring it in a science-informed way. But if the risk are low, I don't mind suggesting my patients and supporting my patients doing something if the risk are low. So before somebody is going to do it, I would like to know, like, what is the risk? And how much is this really beneficial? And if the benefits are not going to be that high, and if the risks are high, I would say that it's best to avoid it. But if the risk is going to be very low, then I think it should be okay. But right now, there is not a lot of data for me to say that everyone has to be on red light therapy. Thank you for that question.
Doctor, there was one particular thing I wanted clarified at this conference, and actually it's two: sugar and fiber. My husband had immunotherapy, and we were I will not mention the name of the hospital. I was actually given a cookbook in the thoracic center full of sugar. I was going to leave it for somebody else. It was beautiful, pictures and all. I threw it away. I didn't want somebody else being misled with it. The other thing was fiber. My son and I were, I mean, this sounds pompous, but we tried to find out about Bill's particular immunotherapy. And the person who made the protocol for it said it wouldn't work without fiber, and we were never told that. We discovered this on our own when he was 3 months into it. And the cancer was so aggressive it was too late. So just for me, a thank you from the bottom of my heart for mentioning sugar and fiber.
Well, thank you. Thank you for sharing that. Well, interesting question. Of course, I don't want to say anything illegal because I have another conference to go to. And I'm presenting there, yeah. So, like, in terms of marijuana, right? So, of course, I have nothing against marijuana. I just want to first clarify that. I have nothing against it. So, CBD helps a lot of people. It helps with neuropathy. And again, there's a lot of talk about CBD. There's a lot of talk about marijuana. But one thing to be concerned about in terms of CBD is it interacts with a lot of things, a lot of interactions with CBD. And of course, it is very difficult to, actually we do have some research going on in CBD and marijuana at MD Anderson. One of my colleague, Dr. Tanko, is trying to do that. Of course, there's a lot of things that he has to overcome before he does that, and he's doing it. But the problem is interaction. We don't have many interaction studies with CBD. So we need to be cautious, especially when people are dealing with other treatments. So the things which can work with CBD is, again, work like CBD is acupuncture. Acupuncture works on cannabinoid receptors. So if you are very healthy, and if it's an appetite problem, and if it's neuropathy issue, then consider acupuncture instead of CBD to have the same effect. But if I have a patient who's not able to do acupuncture, they're very sick and they're not able to go for it, and if CBD helps their appetite, and if CBD is going to help their other fatigue symptoms, I'm not against it, as long as they make their physician aware and they're aware that there is interaction. But quality of life is important. If they're not sleeping, if they can't eat, and they're trying to work on their cancer, then where is the quality of life? So that aspect needs to be taken care of as well. The fiber, yes. The fiber, so your question is if too much fiber bad. I would say, yeah. Yes, yes. Too much of fiber is going to be very hard on the digestive system. So I would not suggest too much fiber. But as you mentioned, ma'am, thank you. And it's very distressing to hear that you were not told about sugar. I apologize. And in terms of the fiber, right, as you mentioned, we cannot have a lot of fiber in our diet. It is just not possible. Like even if you're eating very healthy, it's going to be very hard to get very good amount of fiber in the diet. If somebody is getting a lot of fiber from the diet, I would really like to know, because it's not possible. I've never come across one patient. So I'm doing medicine since 2000, never come across one person like that. So are people taking fiber supplements? This is where, again, I come back to supplements. A lot of times, like protein powders, I have used myself too. If I am lazy and I'm not going to cook this many things to maintain my protein, of course, protein powder comes handy, right? And now we found out about the lead. So we don't know what is going to be the future for fiber supplements. If you're getting it from food, it's not like food is going to be 100% perfect, but it's much better than taking lead and taking other things. So I would say improve the diet, right? And take a lot of fiber in your diet, but don't go for fiber supplements or something outside. And there's no concern for exceeding fiber in your diet, I would say. Low fiber is a bigger concern, as you mentioned, rather than a high fiber, which can cause problems, but is taken artificially. Sorry, go ahead. Thank you for the question.
You mentioned some videos that we could all watch that would show us a little bit about integrative therapies. What is that URL?
I'll go back to that slide. So it is not all integrative therapies, but we have like progressive muscle relaxation, guided imagery, yoga, Tai Chi, Qigong. Let me get to that slide. So you can Google and get to the same website, but it may be easier if you want to take a picture. It's not opening.
While you're looking, we're going to ask the last question.
Yes. Okay.
You said to eat mushrooms. Is there any particular kind? Supermarket mushrooms or?
Oh, okay, right here. Yeah. So medicinal mushrooms are now in the supermarket. So there are so many medicinal mushrooms. There are some we get here, some which is only available in China. But the mushrooms that we get here, like shiitake, is a medicinal mushroom. So often in the mushroom world, shiitake is criticized as weakest medicinal mushroom. But I would say that is the one which is available in the market. So it's easy to get. White button mushrooms is another one. You can get agaricus, white button mushrooms, udier. There's so many mushrooms, shiitake mushroom. And also, I'm not sure about here and other states, but in Texas, we have so much. Lion's mane too. Yes. Lion's mane is very good too. Maitake as well. Reishi as well. But what I'm talking about is grocery store mushroom, because the reishi is available as tea, cordyceps, and there's so many other mushrooms that are available, but I'm talking about what you can find in the grocery shelf. So in the grocery shelf, shiitake is available, as you mentioned. Lion's mane is available, as you mentioned. But I haven't seen in few states, but I've seen in Texas, it's all over the place. Lion's mane is there. We have maitake, we have shiitake, we have regular, like white button and other mushrooms. So use all types of mushroom, but shiitake, maitake, lion's mane, or the 3 medicinal mushrooms that you can use. Reishi, if you're using it as a tea, it's okay, but if you're using high-dose supplements, again, I will be concerned. People use turkey tail. Again, I would be concerned about turkey tail, because turkey tail has PSK, which is great for gastric cancer. It's not well studied in other cancer. And even when people with gastric cancer, breast cancer patients often use it. But again, in turkey tail, I do see the liver numbers go up, liver function test becomes abnormal with turkey tail, and that is because there is some liver toxicity associated with it. So if somebody tries to take turkey tail, I always tell them, make sure your liver numbers are monitored. And again, interaction. One study we did in MD Anderson, there was an interaction between one of the mushroom supplement and Temodar. So the mushroom supplement interfered with the excretion of temodor. So we need to also study interaction between the PSK, the active ingredient of turkey tail, along with chemotherapy. So that is something that I would love to do. I'm looking forward to do. I'm talking with few mushroom companies, but we need to clarify that before we tell people that it's okay to combine it with your treatment. So until then, stick with grocery store mushrooms. But when you see more studies coming up, I'm sure a lot of people are studying on this. So someday there will be clarity on these studies, and then we can say, okay, people can take this supplement and we can monitor and you should be fine. But thank you for that question.